You're listening to IHC's podcast. Today's topic is Culture is Medicine. Welcome to the IHC podcast, where culture meets community. I'm your host, Marissa Hemstreet from the Canyon Band of Navajos and the communications coordinator for the Indian Health Center of Santa Clara Valley, where we provide medical, dental, counseling, WIC, and prevention services to over 23,000 members, while specializing in the unique healthcare and needs of American Indians and Alaska Natives. And today we're here speaking with
Aloha kako. My name is Nikki Apana. I use she, her pronouns. I'm Native Hawaiian, and my dad's side of the family is from Maui, but I was born and raised in San Francisco Bay Area. I am currently a fourth year medical student at UC San Francisco.
Aloha mai kako o kani kumbapa ko ino no vai mai ono kaina uiwi o vai hino ko ohana. Hi everyone, I'm Buddy. I'm a second year medical student at the University of Washington. I was born and raised in California Bay Area in San Rafael. But my ancestry comes from Kau, Hawaii, which is the southern point of Hawaii, and I am Kanaka Maoli or Native Hawaiian.
Aloha kako. My name is George Nakahara. I'm born and raised in Seattle, Washington. I'm Kanaka Maoli. My dad's side of the family is from Hamakuapoko in Maui. And I'm a fourth year medical student also at the University of California, San Francisco.
Awesome. Thank you all for joining me for today's episode of the IHC podcast, Culture is Medicine. It's really wonderful to have all three of you here. So would anybody like to share a little bit about their journey? We got a little bit about like where we grew up, a little bit about our cultural and heritage, but what decided or what inspired you to pursue medicine?
Yeah, I'm happy to start. So as I explained, my name is Nikki. I grew up in the San Francisco Bay Area, but my dad's side of the family is from Maui, and I would go back often in the summers to spend time with family. And even though I grew up on the continent, I very much stayed grounded in culture through dancing hula, which I've been doing for the past 10 years. One of my biggest inspirations, I would say, to pursue medicine is I have a really close family member who has struggled for most of my life with homelessness, mental health disorders, and substance use disorders. And just seeing him have to navigate a healthcare system that really wasn't built for people like him made me interested in becoming that primary care physician that would help him bridge that gap and address some of those health needs and concerns that he was having. And I also am very inspired to serve Indigenous communities and bring very much a cultural lens and an understanding of intergenerational trauma and the need for more holistic healing practices that go beyond just treating symptoms.
Wow, that's very impactful. Thank you so much, Nikki. And then would anybody else like to touch on that question about what inspired you to pursue medicine?
Yeah, for me, it's very similar. I grew up having little access to Indigenous healthcare. For a little bit of context, Native Hawaiians have a federally established healthcare system like the Indian Health Service, but it only exists in Hawaii. And so I grew up in the Bay Area without access to um, Native health in general, and especially without ever having a Native physician. So one of the things that inspired me was definitely access. I think what really got me into doing medicine was also the similar element of having culture be a really strong component of how my mom raised me, and getting to go to Stanford um, and study my undergraduate years, the understanding of like how culture and medicine intersect, and learn that there's really impactful ways you can take biology, which is another interest of mine, and integrate it with our culture and our community to help people become healthier and or maintain their health. And I think for me, those are things that really help me motivate myself. And then on top of that, just having like an ancestry in a healing and health care practice on the traditional medicine side of things with several of my ancestors, I think also helped motivate me.
Thank you. And what about you, George?
Yeah, I think I grew up son of healthcare workers. My dad is a physician and my mom is a nurse. And so it's something that I saw all around me as a kid. And my dad's the Native Hawaiian side of my family. And so I had this, what I think is a more rare experience of not seeing the separation between, Indigenous identity and traditional healthcare, because or the Western side of healthcare, I should say. Because I saw my dad, he would be calling friends and family, they'd have questions and they'd call him up and he'd be there kind of like bridge to medical care for a lot of that side of the family and for friends and neighbors in the area too. And so that first got me started thinking that healthcare, medicine can be a really powerful identity. And then I think similar to what folks have said, just, especially as a kid, going to Homa Kaikai, like these camps and like reading the stories and history of Kanaka Maoli, especially in like the 19th and 20th century and up till now, and seeing how lack of access to care and disease has seen the impact that it had on our people, and being motivated to try to do something for, us. Uh, I think that kind of also was a big push for me in terms of, like, okay, I want to do something tangible to help other Kanaka Maoli. Healthcare seems to be a pretty good way to do that. So that's what brought me to medicine.
Thank you all for sharing what inspired you to pursue medicine. So we're here doing the IHC podcast today because George and I actually met at Stanford Powwow this past May. So thank you so much, George, for the connection. And, we were even just talking about like the IHC podcast in general. What kinds of stories do we usually feature? We go in between having folks who are a part of Indian Health Center, to share a little bit about their job so folks can kind of get a behind the scenes look of what Indian Health Center is, all the other services that we offer, because some of the things that we do, a lot of folks don't really know. They just see us as like a medical and dental place, but they don't know that we actually have counseling, we have a wellness center. And then the other part of what IHC podcast is the culture is medicine aspect, where we talk to other folks in the community about how their culture relates to their overall wellness and just that importance of your ancestral roots. And so, I'm thankful to have you all here today with us. And I'm wonderful that we were able to make this connection something and the reality of all of us being here on the podcast today. So that I'm happy. Thank you all. And so another question that I have for you all is, what is your current medical specialty and field of interest? And, what motivated those specialties or interests for you?
Yeah, I'm happy to jump in since I'm an fourth year medical student, so I'll be applying to residency very soon. So I'm interested in family medicine, which is primary care. It's basically taking care of the whole spectrum: kids, pregnant people, adults, elders. And what I really love about it is that continuity of care, the fact that you can treat the entire family and you really get to meet people where they're at. And I mentioned earlier my relatives struggle with getting access to primary care and addiction services. And so I really want to be that physician that can be in the community, meeting people where they're at and understanding like the deeper roots of these issues, like I mentioned earlier, like trauma and colonization and these long-term effects. But I also really love that primary care is about prevention. And so we're really working on addressing holistic wellness and making sure people live healthy lives before things happen and before things spiral. And so I believe that primary care is the solution to our collective healing, and that is what I'll be pursuing.
I'm pretty undecided right now. We're both M2s. So I came in, I think during one of my gap years before medical school, I worked as a surgical technician. And I think that made me really interested in surgery because I like the procedural aspect of it and I like the immediacy. Um, and I'm still doing some like work around surgery in general. Also, our one of our advisors for our native group at UCSF, she's a trauma surgeon, Dr. Bongiovanni, and she's been excellent mentor. It's amazing to watch. I've been able to shadow her. She's fantastic. That being said, I think more recently I've also explored a lot of other specialties, some revolving around internal medicine and emergency medicine. And I do appreciate for those, um, you're, especially emergency medicine, you're like the first person people are seeing at the hospital, first physician in times of need. And I really appreciated, the impact you can have when someone's really, really having a bad time. You're able to get them settled, get them connected with the help that they need. And so I've appreciated that too, but I'm quite undecided right now.
I'm in a sort of in between George and Nikki. I think a lot of my interests have fallen into um, a focus in the primary care fields, but I'm still not entirely certain which path to go, whether internal medicine or family medicine or some in between of the different primary care fields that exist. Um, and a lot of that has to do with getting to be in places like or training in places like Native health centers. So in part of our curriculum at UW, we get to in our first year and a half be placed in a health center and contribute to the care of patients at a very early phase. And so I've been at the Seattle Indian Health Board under Dr. Elizabeth Parks, who is also Native Hawaiian, and having that amazing ability to see what a federally qualified health center operates like, and also one that is dedicated to Native patients as a core part of its mission, really is special. And to see the way that traditional medicine is integrated in, and um, the ways that you can support patients who are in high acuity states. We have patients that come in that definitely need immediate care and chronic illness as well. And I think to me, that's the kind of realm that I would love to get to keep practicing in, is like a Native health center or a similar system where I get to see patients at all different levels of care and um, all different experiences with care, because we can really make a difference in improving the care of people um, who've had hard experiences with care in the past by getting to be natives in medicine and have that barrier broken down. So yeah, primary care I think is definitely where I'm leaning. But again, I'm just the second year now, so I don't have a ton of experience under my belt and have a lot.
Thank you. And I think that's really important, like you were saying, like your approach to taking care of these patients and understanding, like, what types of backgrounds they might be coming from, and also empathizing with their past experiences with, other providers that maybe didn't understand their culture or maybe didn't ask enough questions. And so, it can lead to some miscommunication of what they need to do for their health. So thank you so much for that. Um, I feel like we've touched on it a little bit about how your culture is like shaped the way that you view healthcare and patient relationships, but is there anything else that we would like to add in regards to that?
I was hoping to share like an actual patient experience that I've had, if that might be helpful.
Yeah, that would be totally welcome.
Cool. So, and I really hope for these experiences for both you, George, and Buddy. Once you're a third year medical student and you're in clinical rotations, you're actually treating patients. I think that's when you really find your mission and like what you want to do in medicine. So I was on my internal medicine rotation as a third year medical student in a large urban safety net hospital. And I had the privilege of taking care of this Samoan uncle who had come in, and we had found blood in his urine. So I had connected already with his family just over our connection to the islands and like, being Pacifica people and diaspora, like away from our lands. And so I'd already built this like really strong foundation with them. And so when I heard that him and his family had declined the CAT scan of his bladder that we needed to further work up the blood in his urine, I felt that I was the best person to have that conversation with them. And when I just sat down with them and I just said, from like islander to islander, can you tell me a little bit more? Like, what are your deeper concerns and worries about this CAT scan? And they simply said, we are afraid that this CAT scan will give him cancer. And for us as physicians, for the healthcare team, we were worried that he already had cancer and we needed the CAT scan to figure that out. And him just saying that opened up a much deeper history in the Pacific Islands. There's a longstanding history of nuclear bomb testing that has exposed our communities to radiation and has led to higher rates of cancer in our communities. That is only now getting recognized. And we all have an amazing Native Hawaiian mentor, Dr. Keikoa Tapara, who's an attending at UCLA and a radiation oncologist who's really spearheading this research on cancer disparities in Native Hawaiian and Pacific Islander communities. So it was really his research that gave me the language and context to understand where this Samoan family was coming from. And I was able to address their concerns. I was able to say that is super valid given our history. And this specific CAT scan will not expose you to the amount of radiation that would put you at risk for cancer. And they proceeded with that. And we were able to later diagnose him with cancer. And so I really believe that my cultural background and my knowledge is really what helped bridge that conversation and can be really powerful and just like in the field of medicine when we're pursuing healing and mistrust and recognizing all this intergenerational trauma. I think that we can bring that cultural lens to help patients and educate them.
Yeah, I agree with that 100%. I'm all, don't cry, Marissa. That was such a powerful story. Thank you so much for sharing that. That's not something, or that is something that we see a lot in a lot of Indigenous communities where there is that mistrust and they're like, oh, I don't know if I want to go to the doctor. I do have this problem and it's been bothering me a lot, but like, it's fine. I'll just rub some dirt on it. And I'm like, no, actually, they could be a precursor to like something bigger. So, go get your annual checkup. They're important for a reason. Thank you so much. Does anybody else have anything that they would like to add, especially when it comes to health disparities, from your experiences? What are some like the biggest health disparities affecting Native Hawaiian, Pacific Islander, or Indigenous communities that you've seen?
I guess I'll go a different route because cancer is obviously one that we talk about a ton. Um, and I think it's one that's understudied. So I really appreciate Nikki's story on that personal experience. And again, massive shout out to Dr. Kiko Tapara, who has been spearheading a lot of that research in oncology in Pacifica populations. Um, on top of that, I think one of the major ones that we see is cardiovascular illness, um, and things related to heart disease or um, MIs or other long-term heart issues and complications that can often lead to heart failure. So we see a lot of that in our community, and it's tied to a lot of other chronic illnesses. Our chronic illnesses, like other Native folks, goes back to massive upheaval of our traditional health systems and our food systems. And, we had boarding school systems that eliminated our culture and our language was banned until the 1970s. So some collective historical trauma and intergenerational trauma has led to a lot of impacts. And one of those major things is our hearts. And there's lots of different pathogenic pathways to that, and that would take a whole talk in and of itself. But one of the coolest things I've seen in our sort of discussion around culture and medicine is these new studies, relatively new, the past 20, 30 years. There's been several studies looking at how traditional dance hula impacts our health. My brother's kumuhula, Mapuana de Silva, has been really helpful in those, among other star hula practitioners. And they're randomized control trials that have looked at how hula impacts cardiovascular wellness, in particular with patients recovering from a cardiovascular incident or dealing with like a chronic illness related to the cardiovascular system. And they found that dancing hula, or doing our traditional dance for Native Hawaiians and Pacific Islanders, as well as also non-Native people too, in some of these studies, has been very, very effective. In fact, in some cases, in some ways, better than Western medicine. Standard rehab procedures like running and other effective procedures that are known to be helpful. But the coolest thing is that hula is something that you can also learn your culture through. you form a community through. You do it with other people. Um, you have a an ability to learn something in a way that is low impact on your body. Uh, the movements are all very healthy, and um, especially it's accessible. You can do it at home. You can do it over Zoom. You can do it in a lot of different ways and at a lot of different activity levels. So um, it's extremely effective and something that's super exciting to see. And then you also have the cultural welcoming of getting to be with your community and learn your knowledge and get to maybe share that with grandkids or pass that knowledge forward. And I just think it's a really exciting realm of medicine to see how our traditional practices are valid methods to maintain or restore our health. And culture and sorry, hula is really one of the foundational ways that that's been shown. And other things have also been done to relating to like traditional diet or paddling now or surfing, things like that that have strong cultural holds in our communities. There's now studies showing how those are beneficial to our health at the same level or even better than standard Western procedures. So I think that that realm of medicine is really exciting and can take us from healthy bedside conversations to help patients, you know, build trust with us as practitioners to also defining the type of care that we're able to provide and make sure that it's congruent with who we are as Native people.
Yeah, I love that. And you see that too with maybe not the research, but you see at least like the spirits being lifted up of folks who are just involved in whichever their traditional types of dancing or practices are. So for folks in the American Indian population, Native American, powwow dancing, and things like that. So thank you so much for sharing that. And I like that correlation and even like that being looked at of like what our traditional practices can do for our cardiovascular health. It's dance and there's different types of dances throughout, all of our cultures. That was really beautiful to hear about. And what about you, George? Did you have anything that you'd like to add for that one?
Yeah. Well, I just want to, hammer home what Buddy was talking about. Like, prevention, everyone like says that prevention is the best medicine. And I think for Indigenous folks, and I can speak, just for Pacific Islanders and Kanaka Maoli, like the prevention oftentimes is us just getting back to, our culture, whether it's hula, surfing, traditional food sources, especially. I think also tying back to what Nikki was saying too about how our identities um, can influence care. I think one pattern I've also seen in terms of health disparities with Pacific Islander folks is access, not just, access to like health insurance and whatnot, but I think what Nikki was talking about, maybe kind of, but just not seeing, these systems of healthcare as something that they can utilize or should utilize. Even when it's there, even when it's, accessible, um, not trusting it or not wanting to go to it immediately until it's, sometimes too late. I think, well, my dad once shared a story of like when he was doing his training over in Hawaii, he was on rotation with a patient and it was him and a classmate, and it was a white classmate, and the white classmate went in first, and it was this auntie, and he went in immediately, just asked her like, "What's wrong? What are your symptoms, et cetera, et cetera, et cetera," and she didn't want to talk to him. And then my dad went in, and he's born and raised in Hawaii, and he sat there for a minute, he talked with her, and established the connections and talked about you know um, kind of that shared knowledge of like, oh, where are you from on the island and all of that. And he managed to get his story is just like he managed to get a much, much better um, history and managed to get the physical by establishing that connection, drawing on that shared identity, um, then he would have just like going in there and just immediately asking like, what's wrong? What can I do for you? Um, and doing the exam and all that type of stuff. Um, and then, yeah, I was at this event yesterday, All My Usos, which is like I think they're run by the Samoan Community Development Center. But I was talking with these people at the Regional Pacific Islander Task Force, and they're trying to screen people for hypertension because I think, like Buddy was alluding to, like cardiovascular disease is such a big, big burden for our community. And oftentimes, people just aren't getting screened for hypertension. And I was talking with some of the folks at the booth, and they're saying, like, people come in and every single person who gets the hypertension screening would come back as hypertensive. And she's like, well, they feel fine, but they just aren't going and getting it checked. Until someone like her goes and brings them and says like, hey, we need to tend to our health. So I think again, like some of the access and health disparities comes down to just the history of distrust between, I think, us and the Western medical like establishment. And I think, that's one of the things, um, at least I'm hoping to do is just, try to be out there and try to like say like, I can't speak for everyone, but I can speak for myself and my friends like who are Kanaka Maoli and physicians, like we want to help you. And we want to be available to you. So, but I mean, again, also want to hammer in what Buddy said, just like all the stuff about culture and connecting to that too.
And I think that's something that you see is like a lot of times some physicians who are not maybe like culturally aware or sensitive, and they don't understand that like certain groups of people are a little bit more apprehensive when it comes to going to our doctor visits, and that it's important to put the person first, no matter their culture, no matter where they're from, no matter their socioeconomic background, but really checking in with them and making sure that you are a patient. I am here to provide you a service. Ultimately you're here because maybe something's wrong, or maybe we're doing a checkup, but it's important to, talk to them in a way that sounds like you care. And I think I am so excited for our future coming patients, where they'll be able to meet all of you and feel that sense of connectivity and feel that you care, feel that you understand, that you are going to go an extra mile to, make them feel heard and make them feel comfortable enough to share, some of those vulnerabilities when it comes to, issues with their health. And I even get shy with my doctor. I'm like, well, this has been going on, but I wasn't sure if I should talk to you about this or not. And then, it ends up being something easy that, is manageable or treatable, and nothing that I needed to be embarrassed to talk about, or something that was, I had been putting it off for so long, and then I go and get, an answer of something that I can do to mediate whichever pain or whichever issue I'm having. So I'm excited for your future patients, because I feel that they will feel heard by all three of you for sure, especially with the amount of passion that you've all exuded so far with any of these questions. Has there been any other instances in your work that you've done, or your volunteer work, residencies, where you've seen healthcare professionals engage with Indigenous communities in a respectful, culturally relevant manner?
I think something that I'm really grateful for to see, um, and I know that there's other places doing this, but our uh, Indian Health Pathway at the University of Washington puts us into a mandatory rotation in traditional medicine. So we have to shadow a traditional medicine practitioner. I have not yet done that rotation, but I've gotten to interact with some of the traditional medicine practitioners that host students, as well as some of the students that have gone through that traditional medicine pathway. And I think what's really cool about it is it teaches those of us practicing biomedicine how we can integrate and where we can integrate traditional medicine into our care. There's several really excellent health centers in Hawaii, and also health centers obviously in the continent here, that serve Indigenous patients, that have traditional medicine practitioners who are partners in healthcare, and who share expertise with us and how do we help patients. And um, one of the coolest ways we can do that is just see that, when we're providing medicine, and when we are looking to help our patients through biomedical techniques, what are ways we can integrate traditional protocol into that? How can we maybe bring in a practitioner to help make sure the medicines are passed on in a way that is culturally congruent, rather than just having someone pick it up at the pharmacy and have no protocol around that beyond handing in their prescription. Maybe we can do a little bit of ceremony around the medicine itself to help guide it. Other things too that I've seen is just we're having an issue making sure that a patient helps, or having an issue with a patient having apprehension around a certain procedure that we're doing, bringing in a traditional medicine practitioner to help guide that procedure and be there with the patient, or even offer medicines themselves to help that patient in a healthy way through that procedures, things that can be really helpful. Then lastly, they have traditional medicine has its own expertise beyond our own. And so often I think it's important that we move towards, and I don't know whether we're there yet or not, but move towards making sure that traditional medicine practitioners are seen as experts in the way that doctors are, and seen that biomedicine and traditional medicine can collaborate rather than have a hierarchy. And so my hope is that more work is done in seeing, when we're using traditional medicines, let's make sure these traditional medicines don't have impacts on hypertension, because a patient who has hypertension maybe shouldn't have a traditional medicine that's going to increase blood pressure. So maybe there's ways we can make sure that they get the traditional medicine that they need, as well as make sure that from our framework, from the biomedical framework, that they're getting also safe, effective medicine, and that they can really work together. Um, I think there's a lot of uh, exciting growth opportunities out of the partnership between traditional medicine and biomedicine. And ultimately, I really believe that um, biomedicine, and I think it was this way back before colonization, that a lot of the biomedical techniques that exist today, even surgery, were elements of traditional medicines. So my hope is one day that biomedicine is reintegrated back into just indigenous medicine at large, rather than being considered two separate fields. But that might take some time, and I'm also very young, so I might not know what the best solutions are. But I do look forward to the future of integrating our medicine systems together.
That's beautiful. I like that. And then we've even seen that here at the Indian Health Center, where we were able to hire, I think, at least two traditional medicine practitioners, and been able to do a warm handoff when it comes to having somebody who's Indigenous, who might feel, like you were saying, a little bit more at ease having the traditional medicine guide the biomedical practice, whichever it may be. So, thank you. And that is something that we're seeing more and more, especially in Indigenous health centers, like IHC, and hopefully soon where you're located.
I'll add one more thing quickly. Something that's really cool, I think, is worth pointing out, is that when we were our own kingdom, Hawaii was a kingdom, a sovereign nation before the U.S. took it over. We were one of the first countries in the world to implement a quarantine around smallpox, and also a mandatory smallpox vaccine. And this is the day when traditional medicine was also highly respected, and leadership, our chiefs saw a massive importance in bringing in people that were trained in Western medicine, and sending our own people out to get trained in Western medicine so they could come back and work with traditional medicine practitioners to find solutions to the epidemics that we were seeing that were decimating our people, because neither Western medicine or traditional medicine were fully equipped to deal with those issues. And so there was even research partnerships during the Kingdom era between Western medicine providers and traditional medicine providers to find solutions to the epidemics. And yeah, part of that came out with the first national mandatory vaccine, being the smallpox vaccine in Hawaii in the late 1800s, mid or late 1800s. I'd have to get the date correct, but it's a very exciting thing to see that we do have an ancestral history of learning new medicine and incorporating it into our community. Um, and so I think that really shows the importance of drawing from all knowledge bases to support our community.
100%. Thank you. And that's a really cool tidbit of information that, folks don't always think of when it comes to like Indigenous medical practices, and thinking, oh, anything that's innovative or that's the gold standard now when it comes to, prevention of different illnesses, is that's like a Western thing. Like, actually, no, our people have been doing it since time immemorial. but now it's integrated all over the place. So it's thank you for sharing that, and then reminding folks that these practices have been in all of our cultures for so long. It's not new. Thank you. So one question I have for you all is, as Indigenous folks in healthcare, what made it important for you to start seeing like Indigenous voices and representation in the medical field? If you have any like small story you'd like to share, or how do you feel being that representation in the field?
I think this kind of intersects with one of the other things, one of my last comments of just, that lack of trust being kind of a barrier between like Indigenous folks and the medical system. And, um, you know, as a Native Hawaiian medical student now, I feel this like amazing opportunity and responsibility of like when I approach people and just like hi, like at the event yesterday and at other events, I say like hi, my name is like George Kenji Kaika Nakahara. I'm a Kanaka Maoli medical student. Um, how can I help you? Or how can I like work with you? Um, I think seeing yourself in institutions like medical school and like in um, like seeing yourself represented in physicians. Yeah, I talked about like, with my dad, like it was super huge and make me feel like, oh yeah, the medical system, not all of it might be for me, but I know there are pockets of it that are accessible for Kanaka Maoli. Um, and I think I try to keep that in mind, um, that I am here in medicine, not just for myself, but for the community around me. And so, um, trying to make sure that like I'm participating in like community events and building that trust. And so that I'm able to, when when I'm a practicing physician, um, I can bring people in and I can give them the healthcare um, that they need to get better. And I can be someone, again, I I can't really speak for the whole like Western medical system, whether or not we're going to be able to like get our folks to trust like the entire system as a whole, but at least us Indigenous, practitioners, um, so that we can provide, they'll take advantage of the care that we're offering and that we can get people healthy.
I was just going to bounce off of what George said. I really love that. I think just being Indigenous people in medicine, we are healing our communities. We are the ones that are providing culturally relevant healthcare that actually meets the needs of Indigenous communities. We come with this prior experience of histories and traditional practices that we know work, and we know how to just connect with people and rebuild that trust that sometimes is lost in just the general healthcare system as it is. I also wanted to say that I didn't say this earlier, but I am also an incoming public policy student because I really believe in the importance of having Indigenous voices in shaping the future health policies that affect our communities. Because so much of the time, these policies are created without our voices at the table. And therefore, our needs, it's just like people who are assuming what our communities need instead of us actually speaking for ourselves and saying, this is what we want and need. And I also believe that just having Indigenous representation in the medical field, there's so much research out there that shows Indigenous physicians are more likely to serve their communities. And there are immense physician shortages affecting Native American and Pacific Islander communities. There are also all these health disparities that we've already named that are affecting our communities. And we need physicians in these communities treating our patients and treating them in the way that they deserve to be treated, which I believe is just like having Indigenous people in medicine is the way to do it.
I guess I will absolutely jump off that because I think that's a wonderful point. Not only is it something that we need, it's something that the government owes us. There's, trust responsibility towards Native Hawaiian communities, just like Native American communities, and those trust responsibilities establish healthcare systems and scholarships and really emphasize that we need Native physicians serving Native communities. And I think that that's something that will inherently build trust. Um, and I think that, all of us also, I know Nikki, George, and I all danced in college and all have taken on efforts to learn our language and made sure that we're also learning how to be good cultural stewards, and community leaders through protocol ways so that we can be um, effective community partners as well as providers. And I think that that's something that so many of Indigenous medical students that I know and get to interact with hold pride in, and that our cultures matter. Because when it comes to working with our patients that are Native, being able to wear a culture on our chest allows them to also open up and get the care that they deserve.
Course. And I see that with Indigenous like clients or patients, all over when they find out like, oh, you're Native. I'm like, yeah, like let's drive. And like it's just a really fun, like familial type experience. And you feel like, oh, I have people here. I'm not alone. Maybe I moved to this state, or maybe I moved to this city, or maybe I'm a new patient wherever. But if you find just like one person that's a part of your community, you're like, oh, this is awesome. I have my people. And I see the importance of Native representation in healthcare in general as a physician. For myself, I am currently in school for physical therapy. Go to grad school next year, yay! So I'm so excited for that. And one of the things that when I was looking into physical therapy as like a career, I was like, oh, what's the representation? How many Indigenous folks are there in there in that field? And my heart sunk because it was less than 1%. But I'm happy to say that, since 2018, when I was initially looking into it, the number has slowly gone up, still less than 1%, but it's higher than it used to be. So, hey, we're coming for you. We're trying to get that 1%. So, thank you all for being that representation for Indigenous folks in healthcare. What advice would you give to Indigenous youth that are interested in pursuing a career in healthcare?
Yeah, I have three pieces of advice I love to give. One is just find your mentors. Like there are so few of us in the field, but we exist. And I can speak for myself. I'm very, very happy to mentor and support anyone who's interested in pursuing a career in healthcare. So you have my name, reach out. And I would not be where I am today without my mentors. So really lean into that. And then the second piece of advice really goes off of that, which is like lean into your community. They're your sources of support, of guidance, of motivation. And if you're pursuing a career in healthcare, it's likely because you see the health disparities in your communities and you want to do something about it. And if you rely on your culture and on your family and on your community, they will get you through that. And then last but not least, which it all ties it together, is like just believe in your mission. Like what you're doing matters. We need people like you in medicine, and you are bringing unique perspectives, skills, and leadership to this field. And so just you're doing this for the future generation of Indigenous people, and we're all here to support you.
Get the opportunity, find opportunities, find people that are willing to support you. Uh, there are so many different events that are dedicated to helping Native folks in medicine. We have the American Indian Physician Association conference coming up this year, and that's one. Um, I know that there's several Indigenous organizations that support Native Hawaiian and Native American pre-medical students, students interested in entering medicine. Our Center for Indigenous Health at the University of Washington even supports certain students being able to go to these conferences. And so, yeah, finding opportunities like that is really important, and it can really help expose you to the types of mentors that can really help you. I think another thing that's important is knowing that because there's so few of us, when you hear the metrics, when you hear the GPA requirements, and you hear all the different talk around what is needed to get into a medical career, mostly there's a lot of talk, and the best thing to do is just make it through. And a lot of us can help with that, who have gone through those pathways before. There's also established pathways that help people there. I know in Hawaii we have like the Imi Ho'ola post-baccalaureate program there's the Y East pathway, and several other programs like it that support Native students getting into medicine and into medical careers by supporting academic and research work. So I think really finding those opportunities and also remembering that you are enough, um, and that you have a lot of support, and mainly that you can make it through and there's lots of people here to help.
Off that and just say like, yeah, don't be discouraged. The path to medical school is like really, really difficult. And I think sometimes seeing the lack of representation in medical school or as in physicians can feel very discouraging too. But like my friends were saying, like, finding community can really, really help through that. I mean, I can say that, these two were such a huge, help for me and support for me on my pathway to medical school. I'm here at UCSF largely because, Nikki, told me all about the Native community here and like seeing, like, oh, like friend slash RA, is who's also Kanaka Maoli. Um, it was really, um, it made medical school and it made like UCSF feel a lot more accessible. And then, yeah, I mean, finding your mentors, finding community, that will always, I think that really helps give you the support you need through the process.
Of course.
Uh,
Okay.
One more personal thing, I guess, to that is that I think both George and Nikki have seen me break down at various points, especially around organic chemistry. I have failed before. Um, and, the pathway does come with failure. I think a lot of us um, struggle with that failure, but we are resilient and we can make it through that. And I cannot stress enough how important it was to have amazing people like Nikki and George just help me through those really tough years of organic chemistry. So, um, yeah, I think that the pathway is hard, like George was saying, and it so matters to have the type of support that comes with people that can be mentors and friends and peers.
Yeah, and I also say just like reach out and find it because there are fewer of us here than we would like, but I like everyone I've met is so happy to like mentor and to like help you. So if you find someone, reach out.
Of course. So I went to San Jose State University. I graduated there this last fall. But one of my jobs, thank you so much. One of my jobs there, I worked at the Native American Indigenous Student Success Center, and I was an ISA, an Indigenous Student Success Advocate. We love our acronyms. But as an ISA, one of my tasks was to look at all of the different UCs throughout California, and then I looked through a bunch of different like universities throughout the United States. And my homework was to look at what their native serving like organization, or if they had a department on campus that served Indigenous folks, and to see like what were the programs and services they were offering, and how can San Jose State, better, like, for lack of a better word, mimic that, or embody those ideas. And so a lot of the universities I looked at here in California or throughout the United States, they did have either a student organization, student group, or they had an actual department on campus that was meant towards serving Indigenous folks. So no matter where you are, there is somebody there who, will help you feel like you're part of the community, if that's something that you want to do and get more in touch with your ancestral roots. Yeah. So I do have our last question. And it's what does the phrase culture is medicine mean to you personally?
That's such a big question, but I love the idea of culture as medicine. I believe that culture is the where collective healing starts, is when we really lean into our traditional values. And for Native Hawaiians, I think of community, of aloha or love, kuleana, responsibility, lokahi or unity or harmony, balance. These are the principles that have kept us resilient and will continue to keep us connected, grounded, and give us the ability to continue to heal over time, not just as like individuals, but as communities, as societies. So when I think of like culture as medicine, I really think that it's saying our traditions, our cultures, our values are not just history or in the past, but these are living sources of healing that we can actively take advantage of to make our community stronger moving forward.
I love that. I couldn't have said it better. I know it's a tough one to follow, but Buddy or George, do you have anything that you'd like to say when it comes to what does culture as medicine mean to you?
I will say, like, personally, I mean, this goes to another concept, which, I mean, just like, I think Indigenous people know, Kanaka Maoli know that like healing happens on many different levels. And so like I know like at the times where I've been like the most down, like culture and like being in ceremony has been just so immensely healing. And um, I mean, there's the emotional healing aspect of being surrounded by culture, surrounded by your community, and again, just feeling that support. And then also, going back to some of the stuff that we said about, prevention and, our culture knew how to keep us healthy, knew how to keep us safe. And I think as we're trying to get back to that through all these, through food sovereignty, through, incorporating, ceremony and traditional healing practices, like we're seeing and through, the example that Buddy brought up through hula, like, um, culture can continue to keep us healthy and to keep us safe and to keep us in community with one another.
I first second everything that George, Nikki, Kalani said. So I think to me that is pretty much summative of what it all is. I think the one thing I'll add is that culture and medicine, like George says, is super important to us when we will become future practitioners for our own well-being. There's been a long history of Western providers coming into Native communities. They're not from the community and don't know how to interact with the community. And obviously that impacts their ability to help their community. But it also means that their wellness is not as well supported. Um, in addition, and I think that as Native providers, making sure that we're using our medicine to help our own well-being as we engage this very difficult path, one that is often in a Western institution and in one that is uh, marred by systems that are not built on traditional values. Um, Having to pay for healthcare is something that we never had to do traditionally, maybe trade or offer gratitude. But the concept of not having access to healthcare just because of cost is something that we never had. Um, we all had more first aid skills than we do now. And there's a lot of things that we were able to have access to that didn't exist or that used to exist that we don't have now. So one of my favorite examples is that when we train, we have to learn with cadavers, um, and that is deeply protocoled. And one that for us in Hawaii, there's a lot of ceremonial protocol that goes around working with uh, someone's body. Typically, it was done by a close family member that helped process the remains for ceremony and burial. But when you're learning from a cadaver anatomy, it comes with a very specific sort of Western lens. And something that our Association of Native American Medical Students at University of Washington was able to do was bring in traditional medicine practitioners to help bless the students and work with the students to have a protocol to entry into working with cadavers. And I think those types of things that we can help be protective of ourselves as we're engaging in a Western system is really important. And even within that, reminding ourselves that we do have traditions, especially, in Hawaii, we have traditions with autopsy by traditional medicine practitioners to learn new medicines. We figured out enemas using that approach. So autopsy is something that we have done, and these things may have been done in our communities, but they had protocols that are not upheld by Western institutions. And so having Native community that we can come together and make sure that we do involve protocol is something that's really important and a great example of how we can use our Native ancestry, our culture as protective methods for ourselves as providers, because we will experience a lot of difficulty. And so having those protective elements of our identity and our ancestors is something that I value.
That was beautiful. Thank you so much. And I had an experience. It was in a cellular biology class. So like not even an anatomy class, but the anatomy instructor was like, "We have a cadaver. You guys want to come see it?" I was like, in my, for myself and, being from Navajo tradition, just hearing that, I was like, okay, but do you understand that the thing that you're getting all these students excited to see is a human, is a person that has their own stories, the way that it was announced to the students, it just seemed very unpersonal, it seemed a little dehumanizing. And I understand that, there are folks who are fascinated by this type of activity, but there, for certain people who have certain cultural beliefs, like that's just not something that I wanted to partake in for myself. And I kind of explained it a little bit to my classmates of why I didn't want to partake in it, because there's certain, like you were saying, protocols to making sure that, the spirit of the person that we're looking at is, taken care of. At the same time, we're being respectful. And just the way that the students kind of flocked at it, they're like, "Let's look at this." It just seemed a little disrespectful for myself. And I understand that they don't have that same cultural background. So it's not something that I need to expect them to do. But I like that, where you are going to school, your university, that they, implemented certain cultural practices. And I think that's wonderful. So thank you for sharing that. And thank you all for joining me today.
Mahalo, everyone.
Thank you so much for listening. Don't forget to rate, review, and subscribe. If you like our content, check out our social media. Our handle is @IHC San Jose.